Hi, I'm Mandy Pratt-Chapman, and I'm a health education researcher, health equity advocate, and technical assistance provider based at the George Washington University Cancer Center in Washington, D.C. Much of my work has had to do with educating healthcare professionals about the challenges experienced by lesbian, gay, bisexual, transgender, queer, and intersex people. For example, I'm currently conducting a pilot educational study called Team SGM. That stands for Together, Equitable, Accessible, Meaningful Cancer Care for Sexual and Gender Minority Patients. My staff and 12 wonderful colleagues around the country developed a comprehensive curriculum on what cancer care providers need to know about LGBTQI health and healthcare needs. The curriculum spanned content from risk reduction to cancer screening to cancer treatment, palliative and supportive care, and cancer survivorship. Why is this important? Well, lesbian, gay, and bisexual people experience chronic stigma and social rejection, just like lots of other minoritized people. And many of us have multiple aspects of our identity that lead to heightened stigma and isolation. This social treatment of sexual and gender minorities, along with targeted marketing campaigns by tobacco and alcohol companies, has led to a higher rate of tobacco, alcohol, and substance use among queer populations, especially among bisexual people who are often alienated both outside and inside the queer community. When I was growing up, the word queer was an insult, and people often react to me using that term now. For me, it's the best way to describe my personal sexual orientation, and it feels powerful to reclaim a term that was used against us in the past, to literally change the definition and use it as something positive. So what do you need to know about queer communities and cancer? Be mindful of how social isolation and stigma can lead people to cope in ways that may increase their risk for cancer. Be mindful of how transgender, genderqueer, and non-binary people might experience all pink gowns or all pink breast campaigns when they walk in to get necessary mammograms or cervical screening. Many butch lesbians and genderqueer people who need these screenings just avoid them because of the gendered healthcare environment and gender dysphoria with these procedures. Treat us with dignity and be informed about trauma-informed approaches to medical care, particularly with procedures that may be really uncomfortable or that might reinforce trauma, like cervical cancer screening for transgender men. What else to keep in mind? Well, transgender women who have bottom surgery usually still have a prostate. So while risk is likely reduced if a transgender woman is on estrogen, don't discount the possibility of prostate cancer if PSA levels are above 1 nanogram per milliliter. You heard that right. Transgender women PSA levels should be lower than cisgender men's. Other things to keep in mind, many LGBTQI people have experienced family rejection. Sometimes our families of choice just don't look like other families. Honor and support our support systems. Finally, don't just focus on our deficits. Many of us have learned resiliency as a result of facing rejection and reframing our sources of social support, along with what we value in life. Help us tap into that resiliency as often as possible when facing a cancer diagnosis. Thank you so much for listening and for caring.